She called it 9:34. 9:34. So that's about a little bit over an hour ago. Okay, so update. Tradell is in the hospital, but at a different one. She's at Yakima Regional, and a Mr. Hawk, I believe his name is probably Nathan Hawk. I hope I got that right. He called me, and he's a physician assistant, and he was excellent. He was outraged when he looked at the medical records and got her history and found out, what they had been doing, dumping her. I then proceeded to write a long letter for them to have to go to University of Washington. I sent them, if they needed to airlift her, how to use the helicopter system. I explained, gave all papers, for transfer. I talked with Steve over there this morning, and he was very helpful. And he's waiting for the doctors at Regional to send the transfer. Now, basically what this is, it's an issue of understanding how the system works. You can have a whole part of the country who has, I can hear your microphone's on your keys. Click, 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 click.
Me?
Yeah, you. I'm not clicking, you're typing.
Oh, I'm sorry.
No, just so you know that it's really loud. You couldn't hear it?
No.
You couldn't hear the feedback? Well, I could hear it. All right, so she's now at Regional, and I'm trying to get her transferred to University of Washington. Here's the deal. She has a big mass in her chest, about 10 centimeters like this, plus an effusion, which looks like degenerative, possibly infected, but an effusion, a pleural effusion. And everything's pressing on her pulmonary artery right now. So if this continues to grow, she will die, and it could burst. And if it burst, then all those blood vessels would bleed everywhere, and she'd hemorrhage out. So the answer is a great surgeon, a surgeon who can walk on water. And I believe they may have one there. I looked up and I read about this guy, and he sounds skilled. I don't think he'd be scared. Anybody in Yakima would knew that if they tried to operate, that she'd bleed out. They wouldn't know what they're doing. They probably don't even have an argon beam there. They've never heard of plasma state process. They don't even have those skills. I mean, I was doing that how many years ago? Gosh, in the 90s. And the regular medical community, doesn't even know about this technology. So if I can get her to, his name is Farhud Farjah, trained well in thoracic surgery, and he's there. And surgeons, I think, are really important because they can determine the life and death parts of things a lot better. Medical people are handholders. Take these pills, good luck, pray, whatever. Surgeons are aggressive. And his name meant something to me. It means courage of the lion, or the lion cub. Like you have a cub lion that grows up really strong. And he was given that name. So I'm hoping that he is a strong courage lion, By the time he hears about this case, probably the news about it will be there, and it could scare him, like, oh Jesus, I'm doing, this big case that everybody's talking about, and I'm worried about that. Because if he's not been in the limelight, surgeons stay out of the limelight, because what happens when they get in the limelight, Susan? What happens when a good surgeon gets...
They're at risk for attack, jealousy by their peers. It's a power's involved.
And then some people get in the limelight who are just, PR kind of, like the Kardashian medicine, I would call it. People get in the limelight, and and I'm writing that in this new book. I'm doing that chapter, which will be next up. It's about mesh and men. You know, all this mesh they're putting in women and hurting women. I thought, well, maybe if I write about mesh and men, it'll create some consciousness in the country, you know? And I write about a doctor who called me to meet with me because they were opening up a big practice at UCLA. And you know what she asked me to do? Teach her how to operate. She had never learned to operate on women or any of the technology and things that I've been writing about and lecturing for the last 20 years. But they were giving her this big, huge practice, and that whole story is pretty amazing. You know, the politics of it, the marketing of it, the money of it, and what happened. It needs to be told. But anyways, Miss Collins is in Regional Hospital. She's was treated wonderfully by this Mr. Hawk, and Dr. Chin's her doctor. Now I have to reach Dr. Chin to make sure, because all the documents were faxed to the hospital, probably not to Chin's office. So the referral transfer documents are there, and I'm working with this guy named Steve at the transfer center to transfer the case so that she has a chance. Her only chance is getting the mass out. I mean, otherwise it's going to grow and explode and break down, and she's going to die. And that's the reality. So if you're not a skilled surgeon and you're a medical person, you say, well, here, go to hospice because you're going to die, you know? Or, you know, go home and die. Go die somewhere. But what Virginia Mason was doing was like making a joke of it. You know, putting her on the streets, leaving somebody who is critically ill. Can you imagine that? Putting somebody who's critically ill on the streets, just dumping them, you know? But that's a common practice. Now I'm fine, you know, when I first reported on it here in LA, I thought, you know, I was doing a really good job, but then I realized I wasn't. You know, dumping a patient wasn't seen by the press nationally as important. You know, you didn't see any big TV things on it. And even the television here was weak. Like, they didn't even try to go interview these people or, you know, show the picture of the hospital, show the person. They were dumping people in their hospital gowns, Susan. They gave one guy money to take a bus, and he left in his hospital gown. I mean, crazy stuff. And yet we didn't see it. I mean, that tells me something's wrong about the media and the press. I mean, it's failing us. I mean, why wouldn't they show that? Why wouldn't they show that? Afraid of the hospital suing them? I mean, and is everybody afraid? What do you think?
No empathy.
Definitely no empathy.
It's not being reported upon.
Well, it's not them. I think they see everybody who's in this situation as poor, ignorant, drug addicts, or, well, you know, they discount the people. They discount people. But, okay, why I'm so emphatic, angry, and enraged was because it happened to me. It happened to me. I was home alone, my daughter off at college, my friend off at some big scientific thing doing, and nobody at home. Nobody at home. And I'm driving, and I feel like I'm going to urinate all over, and I'm dizzy and faint and all these things. And I realize I have the symptoms of diabetes right now, you know? And I'd been working around the house, so I was like in a t-shirt and jeans, right? T-shirt and jeans. So I go to St. Joe's Hospital in Burbank, go to the emergency room. I tell the admitting and the nurse, I'm a doctor. I'm a surgeon. I think I have diabetes. I think I have diabetes. So they put me in, a little curtain room in the ER. I give them my urine, and my urine sits there, but I don't know the time anymore because now that I'm in the hospital, I'm going unconscious. Okay, I'm drifting into unconsciousness, and then every once in a while waking up, and then drifting back into unconsciousness. All right? The nurse, who had beautiful blonde hair and diamond earrings, I remember she had huge diamond earrings, whispered to the attending ER doctor, whispered this: "She's just here for a bed and a meal. She's just here for a bed and a meal." She didn't look at my record, didn't get a history, didn't talk to me. She looked at my clothing, and because I didn't have diamonds on, how could I be a doctor? I didn't have an expensive watch on. How could I be a doctor? That I was fabricating a story. So for 4 hours, I was left in off and on coma state for 4 hours. 4 hours. That's St. Joe's Burbank Hospital in Burbank. And I haven't even begun to try to get even with that. This woman, if I saw her, and I was in a different time and space, I'd probably be Oriental. I'd samurai her. I'd dice her to small pieces. She is not worthy to be a human. She didn't even look at the chart. You want to guess what my blood sugar was?
Way low?
No.
Way high?
How high is high, do you think?
Over 300?
850.
Oh my God.
Incompatible with life. Incompatible with life. But while I was drifting in and out, okay, I had that vision of the warrior, and I was not going to die. I was going to survive and get the hell out of there. And I did. And I did. But she was working to have me dead because of her own conceptions. And she should not be a nurse anywhere. She should not be a nurse anywhere. And I wrote and I complained. I did everything I could do, and I couldn't get any response. Oh, I'm the bad doctor, the medical board, and they didn't even evaluate it. Joint Commission didn't even evaluate it. But I'm not done yet. You see, everybody thinks there's a time period. They see, okay, well, we're free. We got away with that. Everything's good. What I have planned for them, they have no idea.
So,
and when I do it, go ahead.
With a finger stick, they could tell within 30
2
seconds.
seconds.
Right.
Seconds, right.
So they didn't even stick your finger? They had you give urine as to test?
Well, after they tested the urine and it was like way off, the color was way off on the dipstick, then they drew the blood and sent it stat, and that's when it came back 850. 850. So I have a plan for them. Of course, I'm not going to say it on here, but the plan for them will make it known, and the event will be known, and it will be targeted on the nurse and the hospital and everything they did, because everything they did after that was the cover-up, the cover-up. Oh, we did everything right. Oh, this was right. There was nothing right. There's nothing right about leaving a patient who tells you they're a doctor, who tells you that they think they have diabetes, leaving in there for 4 hours. Is there anything right in that? Say I was delusional. Say I was an older person, because I wasn't that old then. Say I was delusional. So what? they should have tested the urine and done the finger stick, right? It doesn't matter. It's an issue of medical ethics. You have to deal with facts and reality. My hatred for that hospital, that woman specifically, and then the whole hospital, how it dealt with the problem by erasing it. They erased these problems like they never existed. They erased them. They never existed. It's a terrible thing. So what I have to do is call Dr. Chin now and let him know about the transfer and how to do it. I did talk to Miss Collins, and she's much happier where she is. And again, this guy, Nathan Hawk, physician assistant in Washington, should get an award. He stood up to everybody. And you know why I think he did it? Why am I so angry? Because I experienced it, right? I experienced near death from an asshole nurse at St. Joe's in Burbank, right? So is that going to, I'm going to forget about it? And time passes and everything's okay. That's the Kardashian world we have, where everything's okay if you have lots of money and you got a big boobs and ass. No, everything's not okay. Social media is not okay unless it works towards change. Unless it changes things for the better, so that I would have been tested, treated, and I probably would have had no further diabetes, except sitting there, destroyed my pancreas, my insulin islet cells, They could have saved me.
So was this the very first episode you had with diabetes? Is this what happened?
It's exactly what happened.
When you were first diagnosed?
Yeah. It gets, the stories even worse, but I'm not going to give you all the jewels right now because I can't write every story right away. I have to write only one story at a time that I can do. Right now I'm doing Death by DRG. And Hawk got it right away. I said, no, Miss Collins was at this Virginia Mayo Memorial, and she used up her DRG points, so they dumped her.
Explain again what DRG is, because I think we lost the audio on the first video.
Okay.
At the very beginning when you explained it.
DRG stands for Diagnostic Relative Group. D for diagnostic, R for relative, and then G for group. So relative group means like pulmonary, cardiac, brain, neurology. The group area is how they group testing, operations, everything is grouped. So when you're on Medicare or state, help, they give you an anticipated amount of money for the problem. So they look at it, okay, well, if we're going to do a mitral valve, patient will get 10 days in the hospital. That's a reasonable amount to get through the operation, preoperative, okay, then postoperative care. Then the patient, if that's a good hospital, should leave in 10 days and have no problems. Now, so the DRG tells the hospital how much money they're going to get. And then no more. That's it. So if they don't comply and get the patient out in that time period, they get cut off. They get no more money for the days they stay in. So what hospitals do is they dump patients or they kill them. And the story that I told about David Schuster was they tried to kill him. And that was my first DRG death that I wrote about. But I couldn't get anybody interested in learning about it. But DRG death is common. And you don't hear about it because of our press and media. They don't cover it. They don't cover DRG. It's happening everywhere. DRG death is common. And how many people, how old are you? You didn't know about DRG. How old are you?
I'm
How old are you?
56. I'm 56.
Okay. In 10 years, you're going to be in that group, right? And you're just lucky you learned about it right now. Because you'd be going, what's happening? Why can't I stay in the hospital? This doesn't make sense to me. I'm a nurse. I went to nursing school. Why are they throwing me out? Yes, they would even throw you out on the street. The people who have the money and power don't need Medicare. They don't need state assistance, right? If you're wealthy. You wouldn't be going if you were wealthy to Memorial Virginia Mason Hospital. You wouldn't go there. You'd go to the University of Washington. That's the place. That's the Mecca in that state. You go and get the best surgeons. Best doctors are there. But if you don't even know the game plan and you don't know how the system works, remember the cops I had in my office? They always says, what you don't know will kill you, not can kill you. What you don't know will kill you. At first, when I did a patient did that for me because it was the thing that stayed in her mind when she read No More Hysterectomies, the first time. So she came in and, bought me like 5 cups like this. What you don't know can kill you. When I reprinted it, it's what you don't know will kill you. And that was why these No More books that I'm working on with you to make public everywhere is that these are true things. These are true stories. It will kill you. You have to know this stuff. And our government hasn't been exposing it. Our local government, we had a guy here who did some good work. He's the prosecuting attorney for the county, Mike Fura. He did a good job with the dumping of patients. He did a good job. But he's like, how rare is that? How many city attorneys have gone after the hospitals in the country? I'd like to know that. How many? This is something for the New York Times. I mean, come on. This is a big story. How many people die every day from DRG death? It's not a little baby story. It's a huge story. And I have so many other obligations. I mean, being the only bioethics surgeon, I don't know whether to do this or that or, what to do. I mean, how many things do you give me to do? What's on your list for me to do?
I have a long list.
I mean, how am I supposed to do all? I have my list, and then things happen, and then your list, and then we have Sarah's list. Sarah Robinson is our victim on morcellation, and we have the morcellation issue. So I'm thinking of revolutionary ideas that are truly revolutionary. One thing is that it's good we're making this video, but books are necessary. And what I'm seeing in this transition with technology is that, people aren't really reading as much as they should be and aren't collecting books. I mean, I collect books. I remember all my antique medical books that I had. I'd go back and read books from 1700s, 1800s, trying to walk in time, and trying to see what women's health care was, throughout history. And books have to stay alive. Books have to be forever. And that's one of the projects that I'm working on right now, Forever Books. And I'm going to be writing my No More books so that anyone can write me while I'm writing them. Anyone can be a patient who, what I'm writing about, I can tell their story in the book. It's going to be active. But then the extra point that I like is that when I die, the book is still there. And I'm creating a trust so that that site will stay up forever so that more writers, be it fiction or nonfiction, more writers can write and their books stay alive, keeping the books alive, because no one's doing that. And it needs to happen. I was feeling frustrated when I realized I was trying to, what happened to my book? No more menopause. Where's my book? I'm still waiting to hear from GoDaddy. Where's my book? And then when I see that somebody else used my title and my theories, like, what the hell? Somebody who put pressure to shut me up did this. And that's a whole other story. Like, what's going on? If you get a lot of likes and people like you, you can steal somebody else's book? I don't think so. I'm not gonna lay down and laugh. I don't know. So I just called Veronica. Veronica's at the news station in Yakima. She probably tried, if couldn't get me at 9:30, or maybe she read the email and then ran out knowing where Collins is. Maybe she went over to the hospital, because I sent I sent a notice to the police, to the FBI, and to the Attorney General about the dumping from the Memorial Hospital, because it's a criminal act and I want them charged. And they were laughing. When I said, well, this is a criminal act you're involved in, they laughed. No, we do this. We don't have to keep the patient. We don't have to keep the patient. Well, sorry guys. You don't have to keep the patient. You can escalate the care to a better care center and to a better surgeon and to people who can help the patient. Or you can figure out a program. But you guys don't have any surgeons on your staff who could remove her mass. And what, you can't look up a top surgeon in the whole state of Washington? I mean, they couldn't look up a top surgeon. I mean, what's wrong with them? I'm in Los Angeles and I could figure out who the best surgeon was. What's wrong with them? They'd rather dump this person on the street. So that then when she comes back in, they can get paid. Because you see, she's not going to get better if she's critically ill, right? So some event will happen and they'll bring her back to the hospital. But thank God, whoever picked her up the last time did not bring her back to Virginia Mason. And that she got this Mr. Hawk who understood what had happened. And I was trying to tell you why he was sensitive. 2 of his family members had recently died, and he saw their care and treatment. So it struck him, like a hammer. It struck him.
So
I don't know how many days she has left.
Is there anyone else you want to call before we end the video? Or
we'll try Veronica. We'll try Veronica one more time. Oh, you know what? I can call Tildrea. Yeah, I think people should hear her voice, don't you?
Yeah.
If we can, let me. We'll try the station one more time. But maybe she got. Let me see. I wish she had given me her cell phone, Veronica. She was very nice. She's the one who gave me referrals for attorneys. But I called Veronica?
Yes?
Dr. Hufnagel.
Hi, how are you doing?
I'm doing fine. You're on. I'm recording this.
Okay.
Okay, so go ahead. What do you need from me?
I was calling because I was trying to, I got a voicemail early this morning, like 4:45 from Phil, and I was trying to get a hold of her, but the number that she gave me, it was gave me a busy signal. So
Okay.
I don't know
Okay.
if it was even the correct number.
Since we talked, she's been dumped like 2 or 3 times by Virginia Mason. She's at Yakima Regional, and
Okay.
she got a really good guy. I talked to him last night. He's like a hero. His name is Nathan Hawk. He was a PA there who admitted her. And
Okay.
she's in room 454.
Okay.
And you just call regional, ask for the room. She has her camera. I sent you an email because I filed attempted murder today.
Okay.
So what I did was I notified the Attorney General's office and the FBI, and then I sent it to the police because what they tried to do with her, I haven't slept much for the last few days. So you'll have to verify everything, okay, times and dates.
Right.
You know, the general flow though I'm giving you is accurate. So what happened was Virginia Mason, a woman named Karen, who represented herself as the head administrator, called the police to remove her as a unwanted guest from the hospital, an unwanted guest. His name was Gonzalez. I talked to him and I said, Officer Gonzalez, just do me one favor. Pull up her pants and look at her legs. I think she's in congestive heart failure. He got nervous. She started grabbing for the phone, and she grabbed the phone, talked to me, and then hung up on me so I couldn't talk to the policeman again. Hung up on me. And then I sent a whole list of dumping stories that I sent to you that were covered here. But the big thing is these dumping stories, I think probably in LA did them, but it's never been a national news story for the world to know that this happens every day.
So what is dumping essentially?
Okay. Essentially, dumping is a part of what I call DRG death, and D stands for diagnostic related grouping. And what happens is your state assistance for people who need medical care and your federal assistance for people who need medical care give numbers and amounts of days that people can receive coverage for. Because they don't want a hospital keeping somebody, let's say, 30 days for something that should only take 10 days, right? So the governments don't want to get gouged. They don't want to get ripped off. So the hospitals get clearance. Now, she was in there apparently for 2 weeks, and she should have been transferred to a surgical unit way early because they don't have a surgeon there who could remove the mass in her chest. So they let the mass grow and grow and get worse and worse. So what a DRG means is the hospital doesn't get paid anymore. So what they do is they take the patient and drive them and dump them. They actually do this.
Okay.
It's called dumping. And so he had heard about it last night, and he looked at the records, listened to her history, and he was outraged. His name is Nathan Hawk. He was very good. I've been trying to get her transferred. Well, I did this with a Memorial. Memorial wouldn't even respond to a transfer. Wouldn't respond. She needs to, the only chance she has to live is to get the mass off her pulmonary artery and reduced so that she can breathe. She needs a good surgeon. They don't have one. So if you don't have one, you know what you do? You look for one, and you transport the patient.
Right.
You know?
Yeah.
So,
do you know, I was trying to send a Freedom of Information Act with the Goldendale Fire Department city today, but the only thing is I don't know, like in Washington State, they're very you have to be very specific in terms of what you're asking for, otherwise they'll deny it.
yeah.
So do you happen to know her address or the address of where this mobile home
No, but you can call and get it, but they gave no notice.
Okay.
I think what you'll get help from is I can give you the public relations person I'm working with at the EPA. One of the concerns I have, oh, she's great. I mean, she was really good. She's trying to get me a toxicologist because you see, you could get lung disease that looks like cancer on a microscope, but is not cancer. And that was one of the issues I have in my mind right now. Is it really cancer, or is it, a reaction to this toxic thing? But I mean, it's going to take her to, it was like Friday when we talked, and she had the weekend, so she's going to be looking for someone to help. But she will be helpful to you. You need to be specific. Specific means what notice was given, all records of notice given to the area. And you probably want to talk to the Yakima Nation. They have no idea that any of this is going on. They probably have people who are Yakima Nation people who are getting dumped. Getting dumped and have these cases. I mean, when you're going to be opening up a much bigger crime. It's not this little one woman crime. Got it? Her case is really big because it so involved surgically and physically and what they did, that they repeatedly dumped her, I mean, they didn't have any comments. Yeah, okay. So EPA, what notice was given? What evaluation for toxic substance was done prior to the burn? After the burn, what cleanup was provided?
Okay.
And then what you have to do is get their rules and regulations that they have. You want to get their entire book of rules and regulations that they have at the fire department.
Okay.
And no one's going to really help this woman because it's just take a really strong attorney, because everybody's going to try to cover the whole case up. Because now you have the police involved, and the policeman Gonzalez, all he could do is say, yeah, they called me and had me dump her. And he's going to be a witness for her. He can't be a witness for the hospital. I mean, they're ridiculous if they think, he's going to, and he's not going to lie. But he wasn't told the whole case. He was told their story, All right. Yeah. So you need a complete copy of their protocols and procedures of the fire department. Okay. It could be 300 pages, It could be more. Yeah. But you want the whole thing.
Okay.
You want the whole thing.
Okay. I'm writing this down. Yeah, okay. So I will try and figure out then getting like an address for her, just that way I can try and get the ball rolling at least.
So you're trying to get a what? You dropped out. You're trying to get a what for her?
I said I'm going to try and get the FOIA request here.
Yeah.
So I can at least start something.
Yeah.
So that's what I've been trying to do today.
You should try.
I'll call the hospital and try to see if I can get a hold of her.
Because she's there.
I called her twice and it was, okay.
And she's worried about filing legal documents. So she's going to probably try to do that. And I'm worried about her dying. And you need to get her on camera. And she's carrying the camera with her. That's evidence. I'm worried about that evidence being lost, because all of her clothes and things were lost when she was left out on the street. She stayed at some place and the people there stole her stuff. And Gonzalez knew this, but I have to write the police now and remind them that Gonzalez needs to report the theft on her.
Okay.
Okay?
Okay.
Just call me for anything you need, Veronica.
Okay, I will do that.
And do good.
Okay, I will try.
I know it's going to be hard. You got to. Yeah. I made her laugh too much. I said, "Well, look, you can't stay in the hospital with the orangutans. We've got to get you to the surgeons."
Yeah.
So be strong and do well. Okay.
Okay. Thank you.
And thank you. We need you. Yeah, no. Bye-bye.
Okay.
Bye. So the wheel keeps turning.
Okay.
Thanks, Susan. I've got 5 million other things to get done today just for my own survival.
Okay, so we'll update
Okay, so
later.
we'll update later.
Sure. I've got to get the transport done. That's the next thing. I have to call Dr. Chin and get that done. And she'll talk to Veronica. But it's a fragile situation. I mean, somebody could steal her camera at the hospital. And it shows this whole fire thing that happened without following procedure. But I'll give Veronica the contact at the EPA. I did file the complaint with the EPA about the toxic burn that started this whole thing in January. I'm tired. I got to go drink some coffee.
I know you do. It's
I know you
busy.
do. It's busy.
And B12, and I have a document for the Supreme Court of California due today. Yeah. I have little things to do, Susan. But I much prefer surgery. It was much better than having to fight the system because you could use your own hands and save somebody's life instantaneously. So I'm working on that project to get the license so that I can at least teach FRS and new technology to the next generation, because the last generations have never gotten any of the lessons. They don't know anything. So imagine, that'll be good. So what's on your list for today?
It's my day off.
Okay. Well, let me give you Veronica's number. 509
Let me write this down.
930. Yeah. I'll send you her email because you should send her the thing we did yesterday and today. Everybody's never heard of anybody doing what I do. So you know what they ask? Who are you? What relationship do you have to the patient? What do you do? And I try to explain. I'm a patient advocate whistleblower who actually does things, you know. So
this
it's fun to teach people like that.
This is reality
Okay.
whistleblowing.
Yeah. It's not, yeah. It's a lot of work. Yeah, and but if everybody learns, then more things change, and then things get better. But it was really good to help her, because now she can do what she needs to do, but more. When she sees our 2 videos, it'll spark her. She's a good person. She's the only one in the news in that whole area who called back. The only one.
So,
and I think I contacted like 7.
Do you want to call the patient?
Call.
Or do you have to go?
Well, I can call the patient, but I think she might, let me call the patient. But she might be on with Veronica right now. Well, we'll find out. Hold on. My call list is so long now from just the last few days. Here we go. Yeah.
The admiration.
Hi, this is Dr. Hufnagel. Could you connect me with Tradella Collins' room? I think she's in 545. Could you check?
454.
454. Okay. 454. Thank you.
Nursing home can provide.
Good morning.
Good morning, Till. You're being recorded right now by me.
Okay.
Okay. I just talked to Veronica. She's trying to reach you. She wants to talk to you.
Who?
Veronica.
Oh,
Do you have a
called her.
what?
I called her sometime.
Yeah, I know. She said early this morning. So you have her number, right?
Yeah.
Okay, so she wants to hear from you. I have to call Dr. Chin next and talk about transport. I mean, it's a big surgery, but it's your chance for life. It's your chance to fight. Cutting bones, they have to cut bones to do chest surgery. But you know what? Sometimes they can get through the back and not cut your ribs. So
Why can't they go down my throat?
because it's not in your gut, sweetie. Well, they could go down to do.
It was a biopsy
Yeah,
down my throat.
Yeah, well, they can do that for biopsies, but it's a 10 centimeter mass, so they have to actually remove the whole mass. It depends.
How come they can't do it with laser like you did?
I don't do chest, sweetie. I can do abdomens and pelvises.
But I mean, why can't they do my chest with laser?
They probably can.
They did my abdomen with laser.
Well, we'll see what he can do, and minimally invasive surgery has increased, but nobody where you are is skilled enough. It's called level of skill. It's called a level of skill. That's why you can get transferred.
Well, you better get me around some skilled people because I'm tired of these orangutans.
Yes, they are orangutans.
And Yakima.
Okay. All right. So call her, and I'm going to call Dr. Chin and tell him what I found out about transport. I mean, they've never transported somebody. I mean, these hospitals in Yakima have not transported anybody. They don't even know how to do it.
Oh, my God.
And the administration, at Memorial wouldn't even talk to me. I mean, because they just wanted you dead.
I know.
I know you know.
Man.
I know you know.
Go home and die, Till, is what I kept telling them over and over. That's all you tell me. Go home and die. Go home and die. I said, do you know who the hell you're talking to? You're talking to a mountain woman, a fighter. I'm not going to die for you or anybody else.
Your dogs are barking.
Yeah, I'm sorry.
No, it's
Heard me.
no, Susan, who's recording this, her dogs. You get on the phone and all the dogs start barking, Till. They know a mountain lion's around. Okay, so take care of yourself, and I'm going to call. His name is Chin, Chen, right?
Yes,
Okay.
really.
Well, I don't
Really
care.
nice.
Well, if he's nice to you and he's
Really nice.
well, I got to sort of get him to see the light, right?
Right. And you know who will really be on your side, too? It's Norman Hawk.
Oh, Norman Hawk. I thought it was Nathan because he sounded so like old time good guy. Norman Hawk.
He is.
Norman.
His shoes are like over 14 years old. He's had them resold, and they're so cool. Those old leather doctor shoes.
Uh-huh.
Oh, yeah, he's just like that.
Well, Norman's your hero.
Yes,
And he's my hero too. He did a good job by
he
recognizing
did.
what they were dumping. Oh, Veronica didn't know what dumping is. So,
Didn't know what?
dumping is. So
Oh,
you can explain to her about,
Monica doesn't know much at all of anything.
well, that's because she's never seen this or reported on it. So it's her, she is the one who called back. She is the light. because she's filing papers to get documents from the fire department, sweetie.
Well, let's learn her. She
Yeah.
needs to be learned.
You then learn her.
That's what she did to me.
I did.
Learned me.
I learned her. I taught her.
Yeah.
That's why she's alive. She would have been dead probably weeks ago. Okay, sweetie. Okay, bye-bye.
Okay.
Bye.
Bye-bye.
So she's laughing to deal with, and sort of, twisting things to deal with the enormous depression and fear and anxiety, So Norman Hawk is our hero. And Veronica is our next hero because Veronica is going to get the papers. And we just heard that. She's going to get the papers. She's going to trace it dot by dot. Now I have to call Chin. Till later, I guess.
Okay.
No, do you want me to call Chin? Because I have to find Chin first.
Do you want to call him live online, or do you want to do a private call?
Probably a private call because he if I said it while I was recording it, you saw Veronica was fine with it, So he would be anxious and scared.
Correct.
He's not ready. He's not ready. So I don't want to have that barrier on top of everything. I want his help. So I don't want to hinder his help for my glory, what good is that? It's not going to do me any good. I need his help. All right, sweetie.
Okay, thanks, Vikki. We'll update later.
Okay, bye.
Bye-bye.
How do we call?